Welcome. I'm so glad that you're here. My name is Dr. I'm a board-certified rheumatologist who practices integrative medicine in Hawaii. Today, I'm going to talk about integrative approach to rheumatoid arthritis treatment. So briefly, integrative medicine is an emerging field in medicine. Clinicians from various different backgrounds practice integrative medicine nowadays. Some folks focus more on mindfulness aspects. Some folks focus more on herbal medicine. But one thing in common is that in integrative medicine, clinicians put higher emphasis on lifestyle optimization. So today's goal is I'm going to share some data on inflammatory lifestyle on rheumatoid arthritis, and I'm going to share a story of a patient who healed using integrative approach. So rheumatoid arthritis affect about 0.4 to 1% of population worldwide. It's a form of autoimmune disease. By definition, our immune system is confused and it's attacking our own body. So traditional treatment include the class of medication called DMARDs to cool down overactive immune system from attacking our own body. Challenges in traditional treatment methods is that inflammatory lifestyle is so rampant in modern society. For example, typical Western diet involves ultra-processed food, refined sugar. According to Washington Post, in the US, ultra-processed food made up about 58% of the calorie Americans consume. That is huge. Also, we have toxins such as tobacco, sedentary lifestyle, combined with sedentary lifestyle contribute to obesity, which also fuels inflammatory arthritis. We also carry inflammatory emotions such as stress, anxiety, depression, PTSD. So here, I would like to share some data on each of one of the factors that we discussed. First, ultra-processed food. It is really hard to do clinical trial on certain type of diet and its effect on certain disease. It is known that for rheumatoid arthritis patients, the risk of cardiovascular disease such as stroke or heart attack is higher. And according to recent publication, cardiovascular disease risk is even higher in patients who consume ultra-processed food. We know that refined sugar also increases risk of RA. Obesity raises severity of RA in those populations. Also, in patients with obesity, medications like TNF inhibitor, they don't work as efficiently. What about stress? This study is coming from psychology world. There were studies done on adverse childhood events such as neglect and abuse. And they published that patients with higher number of adverse childhood events correlate with higher risk of rheumatoid arthritis. So we do need to optimize inflammatory lifestyle and implement mindfulness strategies to heal from emotional and spiritual trauma. Patients often cycle through different medications without clinical improvement if we don't address these factors. So I'm going to share a story of a patient, Mrs. B. So she is a female patient in early 50s with 10-year history of rheumatoid arthritis. She's a mom of 2 kids. Her youngest child is sophomore in high school. She works in healthcare. She came to see me for second opinion. She had active rheumatoid arthritis on 3 different medications at the same time. She was on methotrexate, leflunomide, hydroxychloroquine, and due to some side effect from these medicines, she was having frequent nausea. When I saw her, she had swollen joints and she had pain level of 5 out of 10, and she struggled with obesity and food in general. Her main stressor in life was the pain from her rheumatoid arthritis, and she felt hopeless. It was going on for 10 years. So first line approach, she wanted to try a different class of medicine, so I put her on biologic agent called Embro. And for anybody who walks into my door, I address these three big components of health: structural health, nutrition, and mindfulness. For structural health, for body alignment, I recommended her to go through physical therapy. In my opinion, the best kind of approach is something that you can do consistently. So it's important to start somewhere and build up from there. For nutrition, please take a look at the circle above my head. So imagine that is your plate for your meals. I tell my patients who consume Western diet and struggle with obesity, this diet. So 70% of their plate should be filled with vegetable. It's very different from our typical Western diet. A lot of people, for dinner, we eat steak and mashed potato or burger and fries. In Hawaii, we eat a lot of rice and we have animal protein on top. That's our dinner. But so it looks very different, right? So the reason is that the pigmentation in vegetable, they have this chemical called phytochemical. And what it does is that it cools down inflammation. So food is medicine. And then next part is 15% is protein. So I recommend more of the fish, tofu, beans, legumes, and less of fatty red meat. I tell them to limit their red meat consumption to 3 to 4 times a week. If you're vegan or CrossFit athlete who consumes tons of calorie, that's beyond the scope of this talk today. Lastly, I recommend variety of full grain, including brown rice, quinoa, and oats. And I recommend them to avoid overconsumption of white rice or white bread. So when it comes to implementing new tactic for your health, simplicity is power. So if you look at DASH or Mediterranean diet, who are known to have health benefits such as reducing metabolic syndrome or hypertension, they have this one thing in common, which is they emphasize the importance of vegetable consumption. So this is anti-inflammatory diet in simple version, and it is very effective. So the key is 70% of your diet should be vegetable. Next, I recommend everybody to drink at least 60 to 80 ounces of water every day. That is two or three of this every day. I'm not sure if you can see it. Not soda, not coffee, because our body is 70% not made out of water, and without water, our body cannot function very well. No processed food, such as sausage, bacon, ham, spam, and no refined sugar, such as soda or bottled juice. They all have added sugar. Also, artificial sweeteners is as bad. And then for mindfulness, I recommended her to go through meditation training. When patients are going through mentally rough time at home, such as family death or divorce, patients tend to flare. So being able to handle day-to-day stress is very important, and meditation is a very effective tool, among others. In 4-month follow-up, Mrs. B has some challenges. She was unable to implement anti-inflammatory diet, and she came back gaining more weight. She gained about 10 pounds, and her disease was still very active on this new medication, Embro. When I talk to my patients about holistic approach, I often tell them about inner child concept. This is inner child concept in a nutshell. Many of our beliefs are formed during our childhood, and some are not suitable for problems in adulthood like health. I told her a story of my dad. Throughout my life, I always complained to my dad, hey, you eat too quickly. He literally eats within 2 minutes. One day we're having dinner together. I asked him, hey, how was your childhood? He was born shortly after Korean War, and he was youngest of six. He had nothing to eat. So if he didn't eat quickly, he didn't have anything. He is in his mid 60s right now. He still eats within 2 minutes. And the belief that was formed during his childhood, if I don't eat quickly, I will not have anything to eat. That is not serving him very well right now. So we talked about that. Mrs. B also shared her story from her childhood. She also grew up in a very strict household where she was scolded if she leaves any food on the plate. So still, she's in her early 50s. She feels uncomfortable eating food, but now she goes out a lot. She's an amazing lady. People treat her and everything, which led to overconsumption of food. So she recognized her limiting belief, this outdated belief that I'll get scolded if I don't finish my food, or I don't feel comfortable if I don't finish my food on the plate. She worked on it to overcome that limiting belief. What is the biggest motivator of all the human activities? It is actually familiarity, seeking comfort zone. It takes courage to heal. Not everybody can heal. It takes courage to step out of your comfort zone and try anti-inflammatory diet, stay there long enough to make it a new comfort zone, and then you build from there. When you start exercising initially, you may feel more sore. A lot of people stop there, but it takes courage to push through, to persist, and get better from there. So I gave her these assignments. I asked her to journal about why she has to feel better. She did her homework and she said she really wants to take care of her husband who's going through some medical issues right now. And she worked really hard her whole life and she want to travel with good health. The second assignment that I gave her was that I asked her to journal the best version of her life in the next 3 years in terms of health, finance, and relationship. And I asked her to build in a form of vision board. Let's say you're on this journey. If you know exactly where you want to go, and if you have fuel, undying fuel, you eventually get there. So this is her outcome. 4 months later, she came back, and this time she was not having any joint swelling or joint pain. She achieved remission. She was consistent with exercise, diet, and mindfulness practices. She lost 25 pounds in 4 months. She's 4'9", so she lost from 177 to 152 pounds. And she told me this. I didn't think that I would feel this way again. That moment, I felt so proud of her. Now she wants to help her husband heal from his medical condition. This is the model for healing that I used for my own healing process. So there are 4 levels. We have to go from the bottom to top. On the bottom level, we have body. Are you putting in the right nutrition? Are you exercising? Are you doing the alignment work for your body? And then we go to the second level, heart. Are you giving other people love, expressing gratitude rather than asking people to love me, make me feel important? It's a big, important step. The next level is mind. Are you always learning new stuff to empower yourself? Are you working on removing your limiting thoughts? Are you focusing on good and love, not hate or fear? And then the final level is soul, connection with your creator or God. I'm not religious, but if I were God, if anyone comes into my temple asking for healing without putting any effort to the bottom 3 levels, I'll probably say, go back down there. I was a chronic pain patient for 15 years myself. I built this program for my own healing, and I feel amazing. I haven't had that persistent daily pain in longer than a year. I gave my program, this curriculum to my patients, and they were doing well. So it became my passion to bring it to the world, to you guys. So I have many heroes in my patient panel. I brought here some sample success stories from my recent follow-up visits. They had strong why, and they took massive action. As you can see, all these patients doing really well. And many of these patients suffer from poor Western diet and obesity. People lost from 10 pounds to 38 pounds. They're doing well. And you can do it too. You're the hero of your own journey. You know what the best kind of story? It's a comeback story. I just wanted to make a point that anti-inflammatory lifestyle should be at the cornerstone of healing. It works synergistically with your medical treatment. I hope you enjoy this video. Please share this video with someone who would find it useful. Thank you.